Next, let's welcome Cindy Parrott and Jonathan Haydt of Novant Health Brunswick Medical Center. Cindy and John, thank you so much for taking time out of your very busy day, I know, to join me here.
You're welcome. Thanks for having us.
Thanks for having us.
Well, I'm excited to learn about all the new stuff that's going on in the Novant Health Surgical Services Department. So first, I know that our viewers will want to know a little bit about you, so that's typically how we start. So Cindy, if you would go first, tell me about your role at the hospital and a little bit about your education.
Okay, so I'm the manager of surgical services. I'm originally from Virginia, so I attended Virginia Commonwealth University and have a bachelor's degree in nursing. I started my career in critical care. It was the surgical ICU, and that's where I had my first interaction with surgical patients and the recovery of surgical patients.
So you must like it because you stayed, right?
I do, yes.
Great. Likewise, John, tell me a little bit about you.
Well, I'm the assistant manager of surgical services, so it's really a team effort between the two of us. But my primary focus is really in the operating room, because I spent my entire career there, my whole nursing career in surgical services. I graduated from a small community college. I'm from Pennsylvania originally, Allentown, Pennsylvania. And then I went back for my bachelor's degree from Pennsylvania College of Health Sciences.
Nice. So you left those cold climates to come to the beach, right?
Yes, absolutely.
You were smart. Cindy, when did you join Novant Health?
So I have been here a little over 2 years. I moved from the Greensboro area, and my family and I were vacationing here, and we're thrilled. Yeah, and we were thrilled when Novant built the new building, and I was eagerly awaiting for an opportunity to come work for Novant.
Great. Jonathan, how long have you been here?
I've only been here since May of this year, so I'm fairly new to the Novant family.
And so how are you finding it?
I love it.
You love the area?
Yeah, I've been in the area for almost 5 years, but only with Novant since May.
Great. Well, we're happy to have you. Well, I'm curious, Jonathan, what brought you to this area? Did you know about the beach? Did you know about this area?
Not really, actually. It's kind of a funny story where my wife and I knew we wanted to move south. We knew we wanted to live close to a beach, just because he said the weather in Pennsylvania isn't the greatest, so we wanted to come south.
Yeah.
And I was researching different hospitals and just, put my resume out there, and then I got recruited to a hospital in Wilmington, and I never heard of Wilmington. So we literally had to Google and see where is it? And I was like, oh, look at that, it's right by the coast, right near the beach, and so that's how I ended up here.
Wonderful. Well, glad to have both of you here. And over the years, we've had a lot of the surgeons and anesthesiologists on our show who've talked about the operating rooms and so on and so forth. But I wanted to talk with the two of you about surgical services overall and kind of the types of surgeries that are offered at Novant Health Brunswick Medical Center. So Cindy, do you want to lead that off for me?
Sure. So we offer general surgery procedures. That can range from appendectomies, gallbladder surgery, as far as even needing, bowel resections, that type of thing. We also offer ENT services, so tonsils, adenoids for children, urology, gynecology procedures. Vascular is new for us.
That's true, it is.
We are doing some vascular cases now. What am I forgetting? Cataracts.
Yeah. Orthopedics.
Orthopedics, a lot of orthopedics. We have a new procedure that is now available. We have a new gastroenterologist, Dr. Itzkowitz.
Yes, he's been on our show.
Perfect. So ERCPs, we're excited to be able to offer that. That's new for the community. That helps us keep people within the walls of Novant. So we're excited to have that. Am I leaving anything out?
Did you say the dental, pediatric dental
pediatric
program?
Dental.
Oh yeah, that's right. Dr. Lou, she's been on the show too.
Right, so that's a nice.
That is very nice.
Nice for the community.
I'm happy about that. Jonathan, I know that you spend a lot of time around the robot, the Da Vinci robot. So talk to me about some of the procedures that are done utilizing that piece of equipment.
Okay, we could really use the robot for a wide variety of procedures.
Really?
Could be like some general surgeries, GYN, urology, and No, it's a great piece of equipment because it's less invasive than traditional open abdomen procedures. So then that way the patient recovers faster, they have less pain, less blood loss, and lowers the risk of infection. So it's a really great thing to have.
And we're excited because we do have one of our doctors, Dr. Thompson, who he's now doing same-day hysterectomies using the robot.
Man, that's hard to believe.
Right. So that's really exciting that you can come in and have this minimal invasive procedure and go home the same day. I don't know that a lot of people realize that.
Yeah, it seems like such a big procedure, but when you reduce it down to with this equipment, it's like
Right.
pulling out, cutting your hangnails or something.
Right,
It's just that's amazing because I think they used to stay in the hospital about 5 days, and now you get to go home.
Right.
Yeah, that's great. Talk to me about on-site anesthesia.
So anesthesia consists of anesthesiologists who are with Providence. That's the group that provides anesthesia services. But we do have Novant CRNAs, so there's a CRNA and an anesthesia provider for each procedure.
Great, and I understand that that's a great team.
Absolutely.
And they're on call. They're always here. There's never waiting for anesthesia.
No.
And that makes it really nice. So several of our guests have talked to us about the exceptional quality of care that they receive at the hospital, and I think that there are some efforts within your team to improve quality. Can we talk a little bit about that?
Sure. So for our bigger colon surgeries now, we work with our corporate partners, and we try to utilize protocols that are a standard across the nation. And we've just started using, it's called ERAS, it's Enhanced Recovery After Surgery.
I think I saw a billboard about that.
You should have.
Probably.
You should have. Yes, we're starting with colons. Big colon surgeries. That'll be the first group of surgeries to roll out. And what that does is it decreases length of stay. It maximizes patients' recovery time by decreasing narcotics, getting them up and moving. There's a lot of education done prior to surgery. So we're really excited about that. And we've partnered with the med-surg department because it really is a team effort between food and nutrition, the doctor's office, the med-surg nurses, physical therapy, all of those things combined. It really takes their length of stay to sometimes a single day to 2 days after these surgeries that they're able to go home.
And you say there's a lot of education, you mean of the staff? Jonathan, do the staff go through a series of...
Well, it's really patient education. It starts with your PAT visit when the patient
Oh, I
comes
see,
in.
okay.
Yeah, they get all this education, and there's actually like drinks that they have. They drink those prior to surgery.
Really?
You kind of carb load.
Oh, carb load, yeah.
Yeah, it's pretty neat. It's really like cutting edge stuff.
I need to know more about that. That's exciting.
Yeah. So it's so far we've had really great success with it. Hopefully this will be our first year of data that we're collecting.
Oh, that's great. Yeah.
So we'll have more to come on that.
Awesome. Well, it's been a pleasure to have both of you here. It's always interesting to learn about new things like ERCP. And I hope you guys will come back because I know that there's growth in the future at Novant Health Brunswick Medical Center, especially in the surgical arena. So you guys will come back, right?
Absolutely.
Absolutely.
Thanks for having us.
You're quite welcome.